Albertans have pushed the government to react to their own private healthcare plan, and what the government's revealing at this moment shows their true intentions. Welcome to whatever the f this is. I'm Zane Velji. Listen, turns out if Albertans push hard enough, the government emails you canned talking points, and those talking points expose exactly what they're doing with Bill 11, the bill that lets doctors practice privately and publicly at the same time, ending universal public health care as we know it. So let's take a look at this response. The letter opens by saying that lots of people are worried. Well, no shit. And then there's conflicting information. Another win. The Alberta government's entire premise hangs on this line, that medically necessary care will continue to be publicly insured. And that line therein reveals their strategy. This bill is not about paying, let's say, $100 or so to go see a family doctor. Would that be annoying? Of course. And would that hit a nerve? Of course. But they want us to keep debating that and not debating the thousands of dollars you face when you need timely, expensive care. And it starts with surgeries. Sounds harmless, right? You think you never need a surgery until you do. Here's a chart. One day you're fine, next day you're in the surgery zone. Here's why it matters. If surgeons take insured procedures private and sell faster access, no one pays out of pocket, stops being true. Paying becomes a route to timely care, then the only route. It's the beginning of the final act of starving the public system. Your options become 2 weeks and $25K or 2 years on a wait list. From exception to the new expectation, private care. It's like going to a beautiful restaurant with 2 items. First item on the menu, a beautiful steak, expensive as shit, and below it, the same steak, free. Except the restaurant's called We Poisoned the Second Thing on the Menu. Not a fucking choice, is it? So what happens next? Well, you can't pay tens of thousands, so you buy health insurance on top of your taxes, by the way. So a new insurance market forms, more private surgical centers open because the government greenlights more of them, and then the big, beautiful comforts of American healthcare show up to your door. Like surgery, first nothing, then all at once. So what now? This is where banker turned boy who always wanted to be a goaltender, Prime Minister Carney, steps up. Because Smith's plan likely breaks the Canada Health Act. And Prime Minister Carney needs to strengthen it and stop this. Danielle Smith's own health minister said they want the Alberta model copied nationwide. Spreading a bad idea across Canada, it's not a vision, that's a disease. So you can help the Prime Minister live out his goaltending dreams. Go to MakeTheSave.ca, a totally real website that we've created where you can tell the Prime Minister to save universal public health care by stopping what is happening in Alberta. We need to act, or else we wake up in a country where surgery is the product and the worst idea ever is our new reality.